Option C, the removal of the IBP gives Labe a 50% chance of dying within a month, and surviving only a month, and a high probability of dying within a few months. Our defense in option C lies with how one must deal with a gosses. The following two rules clearly explain a case with a patient in his dying moments. The first rule is the fact that it is forbidden to touch or move a gosses, as this can accelerate his death, otherwise known as the active approach. It is portrayed by two examples, shoving a pillow from underneath the gosses's head, or moving synagogue from underneath his pillow. The second rule states that we must allow the soul of a gosses to leave when it is ready to leave, otherwise known as the passive approach. It is also portrayed by two examples, the nearby banging noise of a nearby woodchopper, as well as the removal of a grain of salt from the gosses's tongue. The literal meaning of passive versus active is of lesser importance. Instead, we are faced with a dying patient whose neshama is trying to exit his body. We must make the distinction between doing something which accelerates the exit of the neshama, which is forbidden, versus allowing the neshama to leave independently by removing an impediment or an obstacle. With regards to option C, the halachic determination will be based on the necessity of taking a risk with an operation and the degree of suffering that the patient will endure under this option. To make sure that his suffering is minimized, Labe's condition will be medically managed. Rabbi Auerbach states that where there is much pain and little hope for a real cure, a patient can refuse to undergo the medical treatment in question. Minchat Shlomo and Rabbi Brody encourage obtaining the patient's opinion on how we would like to proceed. Rabbi Brody actually states that we should not try to convince a patient to agree to a surgery which would have very little hope of curing him permanently. Interestingly, we find a few sources which would oppose taking any unnecessary risk, such as Rabbi Reisner, who proposes that we may choose to avoid fear, risk, and pain when we do so in the interests of remaining life. This rationale was laid out by these sources. They all state that one may not cause his own death. However, if one reaches a point where his mind is oppressive to him, as in the case of the elders of Luz, or if one's medical condition deteriorates to a point of no return, as in the case of Rabbi Hanania ben Terajon, then there seems to be a consensus that we can apply the passive approach, allowing the neshama to depart on its own. Returning to our premise of active versus passive intervention, we would like to propose that in our case, the active equivalent would be subjecting Labe to complex treatments. We feel that undergoing these procedures can produce the same result of precipitating death. On the other hand, the passive approach could be equivalent to a palliative type medical treatment, where we provide the patient with maximum comfort while minimizing his pain. Consequently, when the final moments arrive, we can simply coordinate the treatment and allow the proper and timely exit of the soul. Therefore, option C is halachically permitted.
Option A, the